So we treated Jennifer for a downslip, and we also mobilized the sacrum and then mobilized L3. And we've already tested you, so we know all this mobility is improved. I can take up the slack now. There's a little bit of movement there. I can take up the slack, and then I can spring it and it bounces back. Line your stomach. The PSISs are now symmetrical. The top of the iliac shelf is symmetrical. If there's a difference, it's really subtle. Sit bones are symmetrical. I can do superior glide. I see your head bob up and down. So I can take up the slack now, and I can spring it, and it bounces and bounces back. When I go inferiorly, I can take up the slack, I can spring it, and I see your heels move. So the force is translating through the sacroiliac joint into the hip joint down into the lower body. The sacrotuberous ligament, I'm now able to indent. So we had you take a walk. What were you aware of any difference?
I felt more even, more symmetrical.
Nice. You also walk more symmetrical because we filmed you walking earlier, and your left arm you had no arm swing, and it stayed up against it would hit the pelvis, and now that's not happening. Would you come and sit in this chair, because that's a painful thing for you?
Which chair?
Over here, please.
Here? Oh, this one?
Yeah.
Oh.
And per your request, we're preserving your privacy, so no one knows what you look like except me.
I know, I look really awful. I've been traveling all day.
That's all right. It's okay. Just give me your thoughts on how you feel sitting.
I'm not feeling burning in the upper area here at the moment. My muscles are still, I think have some soreness because for 19 months they've been in constant spasms, but I don't feel as much pressure. I don't feel the same contortion of pulling in there as I normally do.
And forward bending was also not tolerated well.
Yeah, I mean my muscles feel tight still, but I don't feel as much discomfort. Right, I don't feel as much discomfort.
She's bending, but I'm not
Right.
not capturing her upper body with the movement. Yeah, she's sitting forward bending all the way, and that's tolerated better?
Yeah, but the biggest thing is sitting. I'm not feeling too much at the moment, so.
Good, so I'm encouraged. It was a very unusual coupling. You just don't see the sacrum go one way and the ilium go the other way. That speaks to a significant injury.
Yeah.
It is so easy for you to keep this benefit. So tomorrow I'll teach you how to do self-treatment for downslip. It's not going to come back. I just want you to feel comfortable with it.
Right.
I want you to feel like you're in control, that you could self-treat it.
If something happened
Yeah.
where I hit got up the wrong way, or I don't know if my muscles from being spasmed for so long are going to try to twist thing back or
No, that's just not going to happen. It's not going to happen. But I'm still going to give you gentle movement and teach you the self-treatment that you can do for a couple of weeks, times a week.
It's going to take a while for all this area to calm down, though, because it's been
perhaps
so spasmed and in pain for so long.
We'll find out. Maybe that's not true. How about maybe?
Maybe, okay.
Yeah.
Okay.
So we'll find out.
Okay.
But I'm pleased with the initial results, especially your history. I mean, this is a tough
I mean, if you're
case.
feeling movement, then that shows we're going in the right direction, right?
Yes, yeah. So we'll stop here. I'll see you again tomorrow, and then see you again on Friday.
Yes.
Yes.
Okay.
And tomorrow we'll film this self-treatment that
Okay.
you can do.
Okay.
All right. Thanks so much.
Right.